Hello to my dear friends, welcome to Forensic Medicine by Dr. Paras, and chapter number 4 we are going to discuss right now about the postmortem techniques. What type of autopsies are there, how to perform, which organ need to be opened first, and what are their significances. All those things we are going to summarize beautifully in this chapter, my dear friends. First, let's talk about the autopsy itself. Sir, autopsy is also known as postmortem examination. After the death, whatever examination we are doing, those are called as autopsies, my dear friends. Different type of autopsies, medico-legal autopsies, pathological autopsies, different type of autopsies we are going to study. Why autopsy is done? The question comes, why, Dr. Paras, why there is a need of autopsy? Autopsy is basically done to know the cause of death. To know the cause of death, we'll do the autopsy. It's very important. Where the first autopsy in the world has happened. The first autopsy in the world has happened in the Virginia. Where is Virginia? In the Italy, my dear friends. In India, where the first autopsy has happened, the first autopsy has happened at Chennai. Who did that? Edward Bulkley. Edward Bulkley was the first person who performed autopsy at Chennai, my dear friends. And what case was there for which the autopsy was done? Done for the arsenic poisoning, my dear friends. There was a case of arsenic poisoning. In the poisoning chapter, we are going to discuss frankly about the arsenic poisoning in detail. But in India, it was at Chennai by Edward Bulkley, done for arsenic poisoning. Now, type of autopsy, if we talk about the type of autopsy, the number one type of autopsy I would love to discuss with you is a medico-legal autopsy. So, medico-legal autopsy is most common type of autopsy which is in India, which is performed in India. Why it is done? Sir, it is done in the medico-legal cases. For example, unnatural death has happened. If you are suspecting homicide, suicide, accident, then medico-legal autopsy is performed. And in such cases, when you suspect there is a murder, when you suspect there is a suicide, person tried to kill himself, you have to prove also that he died of himself only. What differences you can actually estimate in homicide and suicide? A person died because of homicide, someone killed, there is a sign of struggle. Means person tried to save himself or herself, but he or she failed to do that. On the other hand, if person died because of the suicide, the sign of struggle is absent. If, for example, a person died because of the hanging. Hanging is a method the person chose for the suicide. Now you will see only the mark present over here. No hand fracture, no contusion, no abrasion, nothing would be there. So in medical autopsy, you have to prove these facts only. Accidental death was there. Accidental death, the person was on road, how vehicle hit it, and were those injuries which are presented in front of you are actually meeting the criteria or not. So these all sets you need to frame in a single line and you need to justify it. No. Consent is needed or not needed? No need of consent from relative. Now, who can request for this? Investigating officer, and you know the significance of investigating officer. Investigating officer will be going on to the site of crime and will be preparing a panchnama. Panchnama, police inquest he is doing, and he can request, because moment he went on to the site of crime, he suspected something bad happened over here, something which is unnatural, something can be suicide, something can be homicide, something can be accident. For that purpose, he collected the dead body from there. He has given to the forensic expert. Forensic expert has done the autopsy. Autopsy report is submitted to the magistrate, and then dead body is given to the family back, my dear friends. In this medico-legal autopsy, whole body autopsy is done from head to toe. The whole body autopsy is done, that is starting from head and will go till toe. So this is all about the significance of the medico-legal autopsy. Again, I want to summarize. Medico-legal autopsy is most common type in India, done in medical cases like unnatural death has happened, for example, homicide, suicide, accident. no need of consent from the relative, done under request of investigating officer. Whole body autopsy is done, every part need to be checked, every part need to be examined, and this is how the report is prepared in the medico-legal autopsy. So main request is done by the investigating officer and relative consent is not at all required. Now coming to the next type of autopsy, if we talk about, that is clinical or pathological autopsy. This is again done in case of natural death to identify the pathology of the death. It is happening done in case of natural death, means person died, person was hospitalized and person died. A person was under medication and the person died. You all know that the person is suffering from hypertension, person is suffering from some kind of disease where he or she was taking the treatment. Now their relatives want to know the cause of death. For them, they need a consent. The police officer, the medical team need consent from the relative just to prove what pathology led to the death of a particular person. So this type of autopsy is called as clinical or pathological autopsy, my dear friends. Done in unnatural death to identify the pathology of the death, relative consent is mandatory. Where in the medico-legal autopsy, which is done in case of unnatural death, relative consent is not at all mandatory, my dear friends. Third type of autopsy, my dear friends, is a virtual autopsy. Guys, virtual autopsy, the word itself is telling you virtually you are doing that. Virtually you are doing that, that means this is non-invasive autopsy. The first point itself is telling you that. This is non-invasive autopsy, uses what you can do without going inside, how you can dig the truth, my dear friends. You can use a CT scan, you can use a MRI, X-ray to identifying the cause of death. For example, whole body scanning is whole body scan with the help of CT scan, MRI, whatever the things are necessary, we scan the whole body, and this type of autopsy is called as virtual autopsy, my dear friends. For example, no abrasion, no contusion, nothing on the body, there was a road traffic accident, you know, fracture etc. has happened, or any kind of organ you are palpating and it is not there. So with the help of the virtual autopsy, you will come to know the particular organ is absent and that is contributing to the cause of death. Coming to the next is obscure autopsy. Obscure autopsy means you have performed autopsy, everything you have done what was required to do, but the gross finding, means the finding you have to see with your naked eyes, those are very minimal. You are in if or what? You are in big question mark. To prove that question mark, will take a particular tissue sample. We go for histological examination. When your gross findings are minimal and you have to go for the micro examinations, my dear friends, those type of autopsies are called as obscure autopsies. So first is gross findings are minimal, agree sir. Then other tests can be done to know the cause of death. For example, histopath examination, microbiological examination, chemical examination. We have to use the laboratories, tissue samples, all the blood samples we need to send in the laboratories to check further what has happened to my patient. Death in case of epilepsy etc. need additional examination. Epilepsy, brain, seizures etc. you cannot find anything in the body, but to establish the cause of death as a forensic medicine expert, you need to send the sample inside the lab also to know whether the brain was working absolutely fine or not. If not fine, there might be a cause, that is epilepsy, my dear friends. So this is all about the obscure autopsy, my dear friends. Coming to the next thing is negative autopsy. Negative autopsy, the word itself telling you something, amazing you with something. Autopsy here fails to reveal the cause of death. Autopsy fails to reveal the cause of death, that is negative autopsy. And gross and dissection findings are negative. First, you have dissected the body. First, you dissected the body. Dissection of body didn't satisfy you. You went for virtual autopsy also. Virtual also didn't satisfy you. You went for the laboratory, didn't satisfy you. Then you consider that as a negative. Minimal and gross. Minimal and gross both are negative. No finding is there. This kind of autopsy is called as negative autopsy, my dear friends. This type of autopsy is called as negative autopsy. Now coming to the sixth type of autopsy right here, sir. The sixth type of autopsy is called as psychological autopsy. Sir, psychological autopsy is done after suicidal death. You have seen a body was hanging somewhere, sign of struggle is absent. You have primarily figured it out that the person did suicide. In case of suicide, the person must be suffering from any kind of mind disease, brain ka issue. There is a brain issue, my dear friends, that is psychological autopsy. It is done to know the mental status of victim before the death. So person died. Now you want to know whether he was suffering from any known mental sickness or not. What was the scenario he was living in? What condition he has faced? How the environment was there in the society he was living? How was the environment at home where he was living? How the relations were with the family members, with the friends, etc. So question regarding mental status are asked to the family member and the friends plus society. So this type of autopsy is called as psychological autopsy, my dear friends. So these are the 6 type of autopsy. I want to revise for all of you. So 6 type of autopsy what we have studied right now. What are they? Number 1 type is medico-legal autopsy, most common in India. Relative consent is not required. Then clinical or pathological autopsy, where relative consent is required. The cause of death was natural. They know the disease was there, but just to prove the cause of death, they need to do the autopsy. Virtual autopsy, where whole body imaging is done, my dear friends. Obscure autopsy, my dear friends, gross findings are minimal. Other tests can be done to do the cause of death. Histopath examination, chemical, microbiological examination need to be done. Okay? Now coming to the negative autopsy. When all those minimal and the gross findings fails to reveal the cause of death, we call that autopsy as a negative autopsy. There is no finding you are going to see in them. Done. Psychological autopsy. Person dies because of suicide, and to know the mental status of a person just before the death, you need to ask question from the family members, society and the friends, and then you will come to know about the psychological autopsy. This is all the 6th type of autopsies you need to know before the exam. Now we are going to the next topic, my dear friends. Techniques of organ removal. Now technique of organ removal is again a very important topic. Different topics, different techniques, different things you need to remember right here. If we talk about the very first thing is what, sir? Your virtuose method. Virtuose is a most common method of organ removal. How you will remove the organs, sir? One organ. For example, heart removed, lungs removed separately, then stomach, then sir liver separately, then sir small intestine separately, then sir large intestine separately. So separately, eyes separately. So everything you are removing but separately. This type of method is called as virtuose, and virtue is the most common method, my dear friends. Now coming to the second method, that is Ghon's method. A Ghon's method is also called as en bloc method. The word block is important right here. So block is like a region. So here it is written very particularly, particular region is targeted. For example, cervical block, cervical block, cervical block. Whatever the organs are there. For example, thyroid gland is there, sir, epiglottic cartilages are there. This area is removed. This is called a cervical block. Then coming to the thoracic block. What organs would be removed in the thoracic block? Sir, lungs would be removed at once plus heart. So thoracic block में lungs and heart would be removed. Along with that, esophagus might be removed. Then abdominal block. What would be removed in the abdominal block, my dear friends? In abdominal block, you will be removing what, sir? Stomach, sir, spleen, plus liver, etc. need to be removed in the abdominal. So all the group of 2 to 3 organs, 2 to 3 organs are removed. 2 to 3 organs are removed. With this method, if we remove the organs, this is called as Gone method. The other name of Gone method is en bloc method. If we remove one after one after one after one, that type of method is called as virtuous method. One after one is virtuous method. 2-3 organs together is en bloc or Gone's method. Now third type of method which is used right here, sir, it is Litueli method. Litueli method or en masse. The word masse means all organs connected to each other are taken out at once. For example, esophagus is there. Sir, esophagus is connected to the stomach. Stomach is connected to the small intestine. Small intestine is connected to the large intestine. If we remove organ like this is called as Litueli or en masse method. All the organs connected to each other are taken out at once and done when the vessels are intact. This is important point. It is done when the vessels are intact. They are intact with each other. If vessel supply is cut within these organs, you cannot perform this method of removal of organs. So this is Litueli or en masse method, my dear friends. Now the fourth method what we need to discuss right here, sir. The fourth method is Rokitansky method. Rokitansky method is also in situ method. Now organs not taken out from the body. Important word. Rokitansky or in situ method, when organs are not taken out from the body, used in the transmissible diseases like HIV, COVID, etc. The disease which can be easily transmitted and they are very lethal, fatal, my dear friends. In those type of diseases, you cannot remove the organs. That will create further problem, my dear friends. And other than the transmissible disease, you can use this method in infants also. You can use this method in infant also. Infant. So this is Rokitansky or in situ method. Now the next topic is very important. Order of cavity opening in the various conditions. So we are having right here, sir, beautiful table along with us, where we'll be learning about all these things, my dear friends. Cause of death, first cavity and the last cavity we need to open. A very important table you guys need to learn right here, sir. So if we talk about this method, the cause of death, if poisoning is a cause of death, my dear friend, the first cavity need to be open is cranium. Moment you open the cranium, there will be a smell. Because of smell, you will be able to detect which poison he or she might have taken before dying. Last organ, thorax, abdomen and neck in the last. Okay, last organ, then thorax, abdomen and then asphyxial death also we open the cranium, my dear friends. If person died because of asphyxia, we first open the cranium and the last organ is thorax. Yes, thorax followed by abdomen and followed by neck in the last. In poisoning and in the asphyxial death, in the poisoning and in the asphyxial death, my dear friends, the last cavity is neck. Why? Because we need bloodless dissection. Bloodless dissection. We need what, sir? Bloodless dissection. If a person is coming to you with a head injury, head is already injured, so you need to open first the thorax, my dear friends. Then you will check the head. First thorax, then head, my dear friends. So repeat along with me. Poisoning and the asphyxial cases, the first cavity need to be open would be the cranial cavity, followed by thoracic cavity, then abdominal cavity, then neck. Why neck in the last? Because you need the bloodless dissection, my dear friends. If we talk about the head Head injury, the first cavity need to be opened would be the thorax, and the last cavity open would be what, sir? Your head, my dear friends. Now, coming to the other causes, if a neonate is dying, my dear friends, if neonate is dying, the first cavity open would be abdomen. First cavity would be open would be abdomen, followed by brain, my dear friends. Okay? Abdomen, brain. Okay? And if there is a pulmonary air embolism, the cause of death is what, sir? Pulmonary air embolism, my dear friends, the first cavity need to be open would be thorax. The two tests what we perform right here in the thorax, one is water test. Bubbles coming out from the lungs will tell you about the pulmonary emboli. Moment you are making the lungs sink in the water, you will see the bubbles are coming outside. If bubble is coming outside, that means pulmonary air embolism was there. Second thing is, and last cavity to open is not mandatory to know. That doesn't matter. First matters. Neonate, abdomen, brain. Abdomen is the first priority, then brain. Pulmonary air embolism, thorax is there. Water test is there. Now, pyrogalol test. Pyrogalol test, if we talk about pyrogalol test, gives color when it comes in contact with air. If a person died because of, if child died because of the pulmonary embolism, when you inject a pyrogalol inside the lung and then you take out the sample, when you're taking out the sample, you will see the sample will change color. If change in color is seen, that means test is positive. If the test is positive, that means the person died because of the pulmonary air embolism, my dear friends. Pulmonary air embolism. Done. Now, different method of dissection we'll be talking right now, sir. We'll be talking about the heart. How the heart is dissected. In flow method. Follow the direction of blood flow in the heart. So, if you see heart right here, sir. If I draw heart like this is not mine heart. 4 chambers are there. Right atria, left atria, right ventricle, left ventricle, my dear friends. The blood order need to be followed. How will be following the blood order, my dear friends? You will see from right atria, our blood will go to, yes, from right atria, the blood will go to left. From left, it will go to the lungs. From lungs, it will go to the left atria. From left atria to the left ventricle, then coming to the body. So with this, the heart is dissected. How the heart is dissected? We have just read right atria to the right ventricle. From right ventricle, we will see the left atria. From left atria, we will be seeing the left ventricle. This is how our heart is dissected, my dear friends. Spinal cord. How will dissect the spinal cord, my dear friends? It is rarely done these days. Spinal cord dissection is rarely done these days. Anterior and the posterior dissection method is there. Out of these two, which one is important? Posterior dissection method is the most common method we choose in case of spinal cord ka dissection, my dear friends. Third organ is brain. Are you directly cutting the brain? No. Ideally, what the book says, ideally brain is dissected after fixation of brain with 10% formalin for at least a week. Till 7 days, you will fix the brain with the formalin. Then you will dissect the brain. But if you have to do the fresh dissection, then cranial cutting method is what we use, my dear friends. Then coming to the fourth thing is stomach. How you will cut the stomach? The stomach is dissected out with the double ligation method, my dear friends. What is double ligation method, my dear friends? One, you will ligate from the esophageal end. Another, you will dissect from the duodenum. These two ends are ligated and then you will dissect it. Most common area from where you will dissect, guys, this is called as lesser curvature. And this is called as greater curvature. Mostly we do from the greater curvature. We cut from this. But once there is a case of poisoning, my dear friends, we dissect from the lesser curvature. Done? So this is how the stomach is dissected, my dear friends. Coming to the next organ, my dear friends, liver. multiple small cuts along the levers. This is how the lever is cut. Not at once, we'll just cut like we cut sabji, chop, tuck, 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 tuck. So lever, multiple small cuts along the lever are there. Now coming to the type of incision, my dear friends. If we talk about the type of incision, number one type of incision we need to study is eye incision. Is the most common type of incision is eye incision. From where it is given, you can just focus on the red area from chin. From chin, yes, this is chin, to this area. This is what's here? Pubis symphysis. Chin to the pubic symphysis is most common type of incision we give normally in the adults. Coming to the next part, Y incision. Y incision from shoulder to the xiphisternum. See the two shoulders to the, this is xiphisternum to the pubic symphysis. The Y incision is from shoulder to the xiphisternum, from shoulder to the xiphisternum, from xiphisternum it is going to the pubic symphysis, my dear friends. It is going to the pubic symphysis, my dear friends. Coming to the next type of incision, that is modified Y incision, also called as U-shape incision. And this U-shape is used in the asphyxial death. A very important point to remember here. In any scenario, if the word written by examiner is asphyxial death, which incision you need to give? In that scenario, my dear friends, you have to mark answer as modified Y incision. From where it is starting, from where it is going, we'll tell about that. It is starting in the mastoid process. This process right here behind the ear, we call that is mastoid area. So from mastoid process, it is starting and meet in the suprasternal notch right here, sir. This notch is called as suprasternal. From here it is starting, suprasternal notch it is coming. This is mastoid wala part, this is suprasternal notch, and from suprasternal notch it is continuing to the pubic symphysis. So this one is also clear, modified Y incision, also called as U-shape incision, my dear friends. Now we are coming to the fourth type of incision, that is inverted Y incision. This is specifically done in the infant, my dear friends. If infant death is there, my dear friends, then we do the inverted Y incision. From where it is done? Incision midline, yes, this is midline, bifurcates above the umbilicus, just above the umbilicus. If this is umbilicus, just above the umbilicus, it will go like this. This is Y shape. And this is again from xiphisternum only, it is going till the umbilicus. From umbilicus, it will divide into two parts. This type of incision is called as what, sir? Inverted Y incision. So we'll revising all these type of incision right now, sir. So first we have learned about number one type of incision, that is eye incision. So most common type of incision is what, sir? Your eye incision. The most common type of incision would be what, sir? Eye incision. From where it is given? From chin. Yes, from chin to the pupil. Straight line is there. Like eye, if you see, straight line would be there. Most common type of incision. Then we talk about the Y incision. From shoulder to the xiphisternum. Shoulder to the xiphisternum. From xiphisternum to the pubic symphysis. This is Y incision. Then third type of incision is modified Y incision, which is also called as U-shaped incision. Useful in the asphyxial death. The word asphyxial death is something which is very, very important. Start in the mastoid process, meet in the, yes, start in the mastoid process, meets in the suprasternal notch and continue to the pubic symphysis. Inverted Y incision. Incision which is done in the infant. Incision drawn from midline and bifurcates just above the umbilicus. Just above the umbilicus, it is bifurcating, my dear friends. So this is all about the chapter 4 we have learned. Thank you so much, my dear friends.